Good morning, and thank you all for joining me today. I appreciate your ongoing help in educating and informing our community about monkeypox. Let me start by saying that the risk of monkeypox infection remains very low for most people living in Monroe County. As of this morning, we have 6 confirmed cases. After completing our investigations, we have determined that all of these patients were exposed while traveling outside of Monroe County. So we still have no evidence of community spread. This doesn't mean that it isn't here, nor that we won't have cases in the future, especially if we don't take steps now to prevent it and to share what we know. First, it's important to remember that anyone can get monkeypox. And the good news is that all of us have the power to prevent it as well. Monkeypox is not an unknown like COVID-19 was in the beginning. Scientists know what to do to prevent the spread of this disease, and these are steps that all of us can take. We need to make sure our community knows what to do too. My team has started working with local colleges and universities who will soon be welcoming thousands of students to our community for the fall semester. At this point, we have not seen very many monkeypox cases among young adults in the United States. That said, our local campuses would be wise to be prepared for a potential outbreak, and I believe they are. Why? Because we know that monkeypox is spread through very close contact, primarily through vigorous skin-to-skin contact, or possibly with items that an infected individual has used, like clothing, sheets, or towels. College students often live in very close quarters. We know that many are sexually active. And again, while I don't think most college students are at great risk for monkeypox, I also believe it's worth paying additional attention to one's own risk, especially as we get through these early weeks of the semester. Students will be coming from areas where monkeypox may be more prevalent. Infected individuals might not experience symptoms for close to 2 weeks after exposure, and it's still not entirely clear how easy it is to transmit monkeypox when someone doesn't yet have symptoms. That means that some individuals may have the infection when they arrive and not yet know it, which concerns me. If we've learned anything from COVID-19, it's that we need to remain cognizant of what is unknown while we explore those things that we do know. So my first message is for college students. Make sure you know what monkeypox is and how to keep yourself safe. Monitor updates from your campus and from the Monroe County Department of Public Health. Do not ignore symptoms that might be monkeypox, and if you have them, please stay home. Some key points. People of any sexual orientation have contracted monkeypox. The current outbreak among men who have sex with men represents what appear to be particularly high-risk behaviors within this community. We need to focus more on the highest risk behaviors and less on stereotypes of other people. While condoms are certainly effective against many other diseases, they do not appear to provide adequate protection against monkeypox. Sharing sheets, pillowcases, towels, clothing, and other items that come into close contact with skin appear to be much lower risk. But while this is still being researched, it's best to avoid sharing these items whenever possible. My second message is for my colleagues in the healthcare community. Please become familiar with monkeypox transmission, risk factors, clinical guidance, and infection control. This information is easily accessible on our website, monroecounty.gov/health. Please take the time to review the materials that we have provided so that you can recognize a patient with monkeypox and respond as appropriate. Finally, a note about vaccines. Nearly 600 people in Monroe County have received 1 dose of the 2-dose vaccine. Since the initial delivery of vaccine 2 weeks ago, however, we have not received any additional supplies from New York State. We have plans in place to rapidly administer the vaccine when it becomes available, and we are eagerly awaiting for that day to come. As I said before, we are not in a crisis, far from it. We are simply asking everyone to stay informed, to know your risk, and to take precautions. Our website, monroecounty.gov/health, contains a lot of useful and detailed information that we hope you will take advantage of. Again, that's monroecounty.gov/health. And with that, I will take your questions.
Thank you, Dr. Mendoza. Do we have a reporter on from Spectrum? All right, we have Isabel Garcia from WROC. You're next, Isabel. Isabel, you're muted. Okay, we'll come back to Isabel. We're going to go on to 13 WHAM. Is there a reporter on for 13 WHAM? Jennifer Lukey is here.
I'm here, and I'm full of questions. I'll take all their questions too.
You can ask a few.
Okay, let's start with one on monkeypox. You said that 600 people have been vaccinated with their first dose so far. Is there a wait list? How did you access those people, and how many more do you anticipate are waiting for some sort of the first round of the vaccine?
So we actually they accessed us. We made the appointments available, and within a business day, all of those slots were taken between us and Trillium, who is the other provider that's giving the monkeypox vaccine right now. We typically haven't created waiting lists, because we don't have the vaccine available. So I feel like it would be unfair to have a waiting list before we even have the vaccine. So when that vaccine does come, we'll make it available as soon as we know anything. And schedule those people as fast as we can. As far as the unmet demand, it's hard to know. We have had a number of people from other counties come here. I imagine people from Monroe County are going elsewhere. So it's really hard to know how much demand there is. There is certainly more demand than there is capacity to give it right now, which is the unfortunate reality. But again, as soon as we have the vaccine,
why am I on a delay?
Then we'll get that vaccine out as soon as possible.
And forgive me for veering here a little bit, but while we're on the topic of viruses, obviously we are heading in back to school. You talked about colleges, but I know parents are getting ready for K through 12 as well. What kind of discussions are you having with school districts this year about COVID transmission and how they should handle it?
So we are waiting for the CDC to issue updated guidance for K through 12. I was in Albany earlier this week, and I understand that guidance is forthcoming. I've asked the state health department to give us a heads up when they have updated guidance. Their guidance has not yet been updated for the upcoming school year. I have meetings planned, though. I've already met with higher ed, and I will be meeting again regularly as I had before with K through 12. To provide them with updates for COVID, monkeypox, you name it. But for right now, we're still waiting on guidance from the state and the CDC.
All right, Julie, can I sneak one more in?
One more, Jen, and then we're going to go.
I wanted to ask about polio, too. We're seeing headlines from downstate about polio being found and wastewater samples being taken. Do we test wastewater here for that? And what would you like the community to know about polio?
What I would first say is that polio is vaccine preventable. We wouldn't have a polio problem if we didn't have a vaccine problem. The case downstate is in a person who was unvaccinated. We are in the early stages of understanding how polio wastewater testing can be made clinically useful. Right now, I consider it still laboratory information. It's still not yet clear what that means in the wastewater. So I think for right now, the most important message that we can communicate is that polio can be prevented with a vaccine, a highly effective vaccine. And currently it's circulating, the greatest risk is among people who are not vaccinated.
Thank you, Jennifer. We're going to circle back to 13 WHAM because we now have Dalton Williams on. Dalton, do you have some questions?
Yes. Hi, can you all hear me?
Yep.
Hi. So, sorry, was having difficulty signing on for a second, so forgive me if this question was already asked. New York City and other major cities have decided to start just doing one dose instead of the recommended two, just so they can get more people vaccinated initially. Is Monroe County planning on doing the same?
No, that's not the plan currently here. We believe that there may be some immunity provided by one vaccine, but the current approval is for two. And so I would not aim for anything less unless there's an absolute reason or to do so, or signs that one dose is adequate. But we know that 2 doses is preferable, and that's what we're going to aim for.
And then with such high demand, are we going to start seeing more clinics once we start getting more vaccines? And when can we start seeing those vaccines come in?
I hope to see more clinics. I hope to see more vaccine. We don't yet have any additional here. I haven't heard very concrete plans on when we will be getting additional vaccine. We were told a couple of weeks ago that to expect that the second second dose would be available for every first dose that we were provided. So I expect that we'll have at least 600 more doses for those second doses, and then some for more first doses for additional people. But right now, I think the vaccine supply is severely constricted at the state and federal level. We're only doing the best that we can. But I do think that even with a vaccine, everybody can take steps to prevent this. This is vaccine preventable, but it's frankly far easier to prevent this by watching our behavior and being aware of how to prevent the transmission of monkeypox.
Thank you, Dalton. Our next question comes from Victoria from the Democrat and Chronicle.
Julie, I missed the beginning of the press conference entirely, so I don't want to rehash anything. I'm just going to have to rewatch later because I was brought in at the very last minute and I am not up to speed.
No problem. I'll be in touch with you later, Victoria. Our final question today from Raquel Stephen with WXXI. Raquel.
Hi, Dr. Mendoza. I just would like you to just debunk some of these myths that are out there as far as like transmission. A lot of people are saying they spread airborne, and I just wanted to just get clarification on exactly how this is spread so the community can know that some of this is misinformation out here.
So the primary mode of transmission is through vigorous skin-to-skin contact. Certainly, we've seen it in other ways within households. It's another more high-risk situation when there's a known individual with monkeypox in that household. But the vast majority of cases have been through vigorous skin-to-skin contact. The reason why we still have listed as a possibility close, skin-to-skin contact among casual contacts with articles of clothing and fabric is because, it's not entirely clear that those things are impossible, but we do believe that they're very, very rare, much, much less likely to transmit monkeypox than with vigorous skin-to-skin contact. So for now, what I want to emphasize is that vigorous skin-to-skin contact, that's most high risk. People who engage in those behaviors need to take precautions. And the flip side is that for the rest of us who don't have those risks, we are at much less risk of getting monkeypox in this community.
I'm all set. Thank you.
Okay, I think that's it for questions today. Thank you so much, Dr. Mendoza.
Thanks all. Have a good weekend.